Hi, and welcome to Staying Healthy. February is American Heart Month, and so in honor of Heart Month, we have Dr. Dennis DeSilvey here with us. He's a cardiologist at Waldo County General Hospital, and today we're going to be talking about the true definition of overweight and obesity and how that reflects your heart health. Welcome, Dr. DeSilvey. How are you today?
Fine, Andrea. It's a pleasure to be here. Let me begin by explaining some terms and the way I approach the issues of being overweight. I don't like the term obese because I think a lot of people are made to feel guilty by that.
Absolutely.
I don't like the term overweight because I think what one has to do is empower the patient to really, or the individual to really take charge of their weight and their overall health, and that's a big theme in Heart Month. And get their weight down into what's an ideal body weight for that individual. A couple definitions, easy definitions. What constitutes overweight? Well, if you're a woman, if your waist size is more than 35 inches, you're probably a little bit overweight. If you're a man, it's 40 inches. We talk a lot in medicine about something called the body mass index,
Yes.
which is basically it's your height in meters squared divided into your weight in kilograms.
All right.
And a normal ideal body, let's say an ideal body mass index is around 25 to 28. But we all know that there are people, myself included, for example, with a body mass index of around 30, but I'm very physically active and I don't feel that I'm overweight. So you have to work with your physician to sort of find out where do you stand in that equation.
So your waist circumference is a better measurement than BMI, maybe?
I would think so. It's a lot easier to take a tape measure and run
Absolutely.
it around your midsection than sit there and figure out how many kilograms your pounds are and do all the computations. But we do use the body mass index in medicine a lot. We know very clearly that people with body mass indexes over 40 are very high risk of having events and need to do whatever they can do to get their weight down.
Wonderful, wonderful. So what are some tips that you recommend for people who do need to get their weight down? Not necessarily to look fabulous in a bikini, but to really help their heart health.
I think, Andrea, that's a wonderful way to approach it because I think there comes a certain point in life when none of us really need to look fabulous in a bikini. But I think, first of all, it's the individual's responsibility. And first, they need to look at their diet. They need to look at their caloric intake. They need to become educated about what good foods are. They need to eat a good, well-balanced diet with plenty of fruits and vegetables. They then, once they've achieved their caloric intake ideal, then they need to combine that with exercise. The real challenge is that in order to really effectively lose weight, you need to exercise about 60 to 90 minutes, 5 days a week, and most of us can't do that, but you can become more active. So there are a lot of things that you can do. And then the other thing I would say to anybody trying to lose weight is do it slowly. If you're losing a pound a week, that's perfect. Because if you get into a fad diet or you lose a lot of weight, then we all know that it comes back on very quickly, and it's this up and down of the weight that's very dangerous to one's health.
All right. Well, can you explain a little bit? I've heard that so many times that yo-yo dieting is dangerous to your health. What makes that dangerous?
Great question, and unfortunately it's a very complicated question.
Right.
We don't know clearly, but for example, fat is not just fat, it's very metabolically active.
Right.
And there are probably components of the swinging of your weight where the fat becomes more metabolically active. And by that I mean it actually damages your blood vessels.
All right.
It actually injures the blood vessels, and we know that very clearly. Being a diabetic injures your blood vessels. And much of my work with our patients is really to help them to stabilize those blood vessels that have been injured or are being injured so that they don't have future events.
All right. Now, what about this idea that you can be both fit and fat? If somebody is, has, and a lot of these people really do have a BMI over 40, but they say, you know what, I'm fit, I'm physically active. Is that really healthy?
That came from an interesting study that was published in one of our journals about professional football players.
All right.
And what they did is they looked at a bunch of professional football players, and I don't need to tell you that these are big people.
Absolutely.
And they found that many of these professional football players were also relatively healthy. They didn't, and you've got to look at your weight metabolically. Are you diabetic? Do you have hypertension? What is your cholesterol? They looked at these people and they found that they were pretty metabolically healthy. Now they're very active, and it's a somewhat, shall we say, skewed group. I mean, not any of us are professional football players, and we're not that physically active, and so I think one has to be careful about looking at that diet and naively assuming that, oh, gee, you know, I'm kind of physically active, so I don't have to worry. I think that if you are, first of all, you do need to look at the person's body size.
All right.
I mean, there are big people, and they shouldn't conform to little people's weight gauges.
Right.
So I look at that very carefully. I sort of
Okay.
look at a person and say, you know, I think your ideal weight's around 220.
Oh, right.
And if that's where you can get, that's fine.
Great.
And I think that's a much healthier way to look at weight control. And if I know they're exercising and their blood pressure's good and their diabetes is either controlled or they're not diabetic and their cholesterol's good, then I don't worry as much.
That's wonderful. I'm really glad to hear that, because I think a lot of people, you know, really just focus on the number on the scale.
Right.
And you mentioned fad diets. Can you talk a little bit about just, you know, some of the top fad diets? There's so much right now about these high protein, low carb diets. And there's, I think, some debate about whether or not that's good for your heart or not.
There are very significant and tremendous debate about it, because there are some recent studies that suggest that the higher protein, low carb diets may be somewhat more beneficial. The problem is they're hard to follow. The best diet is a good, well-balanced, what unfortunately has gotten the term Mediterranean diet, and a lot of people don't quite understand what that means. And what it means basically is the people in the rim around the Mediterranean Ocean tend to eat a lot of fish, particularly oily fish, upwards of 3 times a week. They eat a lot of fruits, a lot of vegetables. They have a very high fiber diet. They're very active people. They also enjoy their wine and have a couple glasses of wine a day. So they tend to be a very relaxed society. So that may be a lot of what has to do with the lower incidence of heart disease in those people. But I'm not a proponent. I do like some aspects of it. For example, the Atkins diet, I think it is, uses something called glycemic index.
Right.
And that's a very important factor. I teach my patients that, because what that means is some foods have more sugar than others.
Right.
And so particularly if you're diabetic, if you know glycemic index, it's a lot easier to eat.
Wonderful. We have some really good resources on the intranet, and I will put some of those websites up. I'll get those from you, Dr. DeSilvey, and we'll put those up on the screen and also on our Staying Healthy website. Thank you, and I look forward to many more conversations with you.
It's a pleasure always. Thanks, Andrea.
Have a great day.